Okay, so today we're going to talk about something that's often misunderstood, and that's ovarian cancer. We're going to break down what it is, what subtle signs you really need to watch for, and what's new in treatment and prevention. Let's dive right in. I want to start with a number that really puts this all into perspective. 1 in 78. That is the lifetime risk for someone with ovaries of developing this disease. Just think about that for a second. In a big lecture hall or a movie theater, that means more than one person could be affected. It's a really sobering statistic, and it's exactly why this conversation is so important. So, what exactly is ovarian cancer? Well, at its most basic level, it all starts when cells in or around the ovaries just start growing like crazy, completely out of control. And this uncontrolled growth creates a mass, which we call a tumor. That's really the core of the disease. But here's the thing, it's not just one single disease. There are actually a few different types, and figuring out which one it is, well, that's absolutely key to diagnosis and treatment. And when you look at the breakdown, it's pretty clear that one type is way more common than the others. Somewhere between 85 and 90% of all ovarian cancers are what are called epithelial tumors. These start on the outer surface of the ovaries. The other kinds, germ cell and stroma cell, they're much rarer. But you can see why identifying the specific type is such a critical first step.
All right, let's get into what is probably one of the most critical parts of this whole topic, the symptoms. You know, a huge challenge with ovarian cancer is that its early signs can be incredibly subtle. They're often mistaken for other, much more common issues. And this slide just perfectly captures that challenge, doesn't it? On the left, you've got the early signs, things like bloating, feeling full really fast. I mean, these are symptoms that are so easy to just brush off as part of everyday life. But then, on the right, you see what happens as the disease progresses. The whole game is catching it on the left side, and the next slide tells us exactly how to do that.
And here it is. This is probably the single most important thing to remember about the symptoms. It's not about having one off day or feeling bloated every now and then. The key word here is persistence. If you are having these symptoms more than 12 times a month, that's your body's signal to go talk to a doctor. It's all about that consistency.
So, what puts someone at a higher risk? Well, the factors really fall into two big groups. First, you've got the things we just can't control, like our family history, our age, or carrying specific gene mutations like BRCA1 and BRCA2. But then there's this other group, the lifestyle factors, and this is where we might have some power to lower our risk.
So if the symptoms are so subtle, how in the world do doctors actually diagnose it? This is a really important question because, unlike some other cancers, there isn't a standard routine screening test that everyone can get for ovarian cancer.
Which leads us to this exact question. It's kind of a puzzle, right? If you can't just go get a simple screening, what is the path to actually getting an answer? How do you figure it out? Well, it's really a process of careful investigation, almost like detective work. Doctors will start by reviewing your medical and family history and doing a pelvic exam. If anything seems off, they'll move on to imaging tests, maybe an ultrasound, or a blood test that looks for a protein called CA125. But, and this is key, the only way to be 100% certain is with a biopsy, where they take a direct sample of the tissue.
Okay, so once a diagnosis is confirmed, all the focus shifts to the path forward. And that means treatment and prevention. So what are the options? And what can actually be done to lower the risk?
The goal of any treatment is really clear and direct. Get rid of all the cancer and reach what's called remission. That just means the signs and symptoms of the cancer are either gone or seriously reduced. This one objective guides the entire strategy.
The first and foundational pillar of treatment is almost always surgery. This is the frontline attack, where surgeons go in and work to remove as much of that cancerous tumor as they possibly can. This step is so crucial for the treatments that come after it.
Next up is chemotherapy. You can kind of think of this as the cleanup crew. After surgery gets rid of the bulk of the tumor, these really powerful anti-cancer drugs are used to hunt down and destroy any sneaky cancer cells that might have been left behind. And this is where modern treatment gets incredibly sophisticated. Targeted therapies are a newer type of drug that don't just attack all fast-growing cells. No. Instead, they identify and attack very specific weaknesses in the cancer cells themselves. A great way to think about it is that some of these drugs work by literally cutting off the tumor's blood supply, basically starving it out. It's pretty amazing stuff.
So, can you actually prevent ovarian cancer? Well, while there's no magic bullet, research has shown that some things can definitely lower your risk. This includes lifestyle choices, like keeping a healthy weight, but also medical options, like using oral contraceptives, or, for some people at very high risk, even preventative surgery.
And finally, let's talk about the outlook. You know, getting a diagnosis like this can be completely overwhelming, but it's so important to look at the reality of living with the disease today, and that includes all the reasons for hope.
The overall 5-year relative survival rate for ovarian cancer is 49%. Now, that number can feel really heavy, and it's important that we acknowledge that. But it's also not the entire story.
And this is exactly why that number isn't the whole story. While the statistic is serious, it's really just a snapshot of the past. Research is always moving forward. Every year, scientists and doctors are finding new and better ways to diagnose and treat this disease, which means the outlook is constantly improving.
So let's end with this question for you. From those subtle, persistent symptoms to the incredible advancements in treatment, we've covered a lot of ground. So what's one thing you learned today that you can share with someone else? Because when it comes to our health, awareness can truly be a lifesaver. Thanks so much for joining us.